Welcome back to The Winning Leap. Now, we've talked a lot about how technology will be a universal change maker. It's now time to show you exactly what we mean. At the Apollo hospitals across the country, doctors have access to technology, which is revolutionizing healthcare delivery in India. Take a look. Apollo hospitals have set an example by leveraging cutting-edge technology for safe and effective healthcare. The group has introduced the most advanced CyberKnife robotic radiosurgery system, bringing an unparalleled approach to treating inoperable tumors. Revolutionizing preventive healthcare is the adoption of mobile applications to monitor heart rate and ECG rhythm by the patients themselves. Apollo hospitals have always prioritized the adoption of cutting-edge technology to cement their status as leaders in the healthcare sector. I'm here with Sangita Reddy, who's going to talk to us a little bit about their policies on technology and staying on the cutting edge. Ms. Reddy, welcome to the show.
Thank you. Good to be here.
Great. Let's start with a basic question. So Apollo hospitals have always prioritized the adoption of cutting-edge technology. So why is it important for you to constantly innovate with your technology?
Well, basically the philosophy has always been the same, which is enable bringing the best to patients in India, making it affordable, and reaching out and treating as many patients as possible. And as technology evolves, we need our own systems and our uptake of technology to grow and stay abreast, and that's what we followed over the last 32 years. I think we've not only been the pioneers in bringing in, whether it was the PET-CT or the CT-MR, and even now I think we will be the first ones in Asia to bring in the proton therapy. So we continue to adopt technology which is appropriate for the Indian healthcare system and find ways to make it accessible to our people.
Great, and you've touched upon it a little bit, but can you tell us about some of the more innovative technologies that you've used, both in medical and healthcare?
In diagnostic or early detection, I think one of my new favorites, and there are a lot of them, but one of my new favorites is really the non-invasive diabetes screening.
Okay.
So everybody hates to be poked, but you need to poke someone to find out if they have diabetes, and India is the diabetes capital of the world. So this is a simple scan where you put your hands and your feet, and based on the signaling and of your sweat glands, we can do an early detection of whether the individual is diabetic. I must talk about robotic surgery, because I mean all of us see hi-fi and space and robots are not taking over the theater, but what they are doing are becoming an enhanced tool for the surgeon.
Okay.
And finally, I must talk about technology which is enabling all this, from doctors with iPads. We message from our machines, the lab testing machine, to our hospital information system, to a doctor's phone. Okay. So the speed to his reacting to a patient is far quicker and better. And that's why we have some of the best outcomes, the miraculous cures, because there's so much science and technology behind the work.
Absolutely. That sounds really fascinating. But were there any challenges you faced at the time of implementation and installation of the technology?
Customs duty, the lack of awareness, no engineers to really support it in the beginning, higher prices because the installed base was low. We've been through all these curves, but I think now India is a pretty level playing field in terms of adoption of technology.
Is it? Okay, so that really leads me to the next question. Why is it that more healthcare institutions and hospitals aren't really adopting it, or maybe not yet at least?
Number one, there is a cost. And because we are, unfortunately in a country where universal health coverage hasn't become a reality, people have to pay out of pocket. And when you do that, use of technology enhances the bills, and therefore doctors are always striving to keep the bills low. So first priority would be for the medical consult, second would be for medication, and diagnostics comes a little later. It's the ecosystem to enable. It's insurance to enhance accessibility and affordability. It's a larger installed base, even further installed base. It's technicians who can run the machines so that you're using them well. It's training for doctors. All these are, kind of hurdles in the path of greater availability of technology. But again, I will say I'm the eternal optimist, and I think we've come a long way.
That's great. Can you tell us clearly what are the benefits you've experienced firsthand from the adoption of technology, both in terms of your patients as well as the staff?
It's safer care, it's better care. So if you have a spine surgery with a spine robot, so you can have some technology, or you can have, the beautiful high-end robot ensuring precision, and you definitely get better outcomes when you have a trained doctor, a good team working with the robot. Then you're going to get the best for the patient. To our staff, we have a learning management system, so our training systems are very high. We've tried to make training cool, which in healthcare is not so easy, but we actually have a clinical PlayStation. So all new employees or new family members go in and they learn in the Apollo equivalent of the PlayStation. So it's a combination of videos and tools and questions, and so we tried to make training fun, and through that I think we're creating better professionals who are doing an absolutely amazing job.
Great. That sounds really inspiring. Thank you so much, Ms. Reddy, for being on the show today. It's been a pleasure. Well, on that note, it's clear that aggressive investment in technology for growth is the need of the hour, and the government must take heed of our billion-strong, evolving consumer base and take their cues from the digital world.